Hi, my name is Rona,
Hi, I'm Danielle.
and we're here to talk about and demonstrate the functional reach test.
So, the functional reach test is a performance measure and assessment tool that measures dynamic balance through the maximum distance a client can reach forward beyond arm's length when they're in a fixed standing position. So, this test was developed as a quick screen for balance and stability, and they also have a modified version of this assessment. And this is when we ask clients who are unable to stand to sit in a fixed position. So the functional reach test is a bottom assessment, and the supplies that you'll need to do this test is a yardstick and tape. It'll take about 5 minutes to complete this test, and there's no training or certification required to administer this assessment. This assessment is administered through paper and pencil and is free of charge. And the populations that you would see this test being done are for those who are at risk of falling, and that's usually in the elderly population or frail adults. But you can also see this test being administered to clients with vestibular disorders, stroke, spinal injuries, and Parkinson's disease.
Okay, so how you administer the test in the non-modified version is the client would be standing and they are instructed to stand next to the wall, but without touching it, they position their arm at a 90-degree angle with shoulder flexion and with a closed fist. The therapist records the starting position at the third metacarpal um, at the head of the yardstick, and they are instructed to reach as far as they can forward without taking a step. And then the therapist would then record the end position at the third metacarpal. For the modified version, the client would be sitting, um, performed with a leveled yardstick that has been mounted to the wall at the height of the client's acromion level in the non-infected arm while sitting in a chair. Their hips, knees, and ankles are positioned at a 90-degree angle of flexion with their feet positioned flat on the floor. The initial reach is measured with the patient sitting against the back of the chair with the upper extremity flexed to a 90-degree angle. Measure was taken from the distal end of the third metacarpal along with the yardstick. So there's three portions of the modified version. The first is sitting with the unaffected side near the wall and leaning forward. The second is sitting with the back to the wall and leaning to the right. And the third is sitting with the back to the wall, leaning to the left. Additional instructions for the modified version. The instructions should include leaning as far as possible in each direction without rotation and without touching the wall. If the patient is unable to raise the affected arm, the distance covered by the acromion during the leaning is recorded. The first trial in each direction is a practice trial and should not be included in the final result. And a 15-second rest break should be taken between trials.
So the scores of this assessment are determined by assessing the difference between the start and end position. As Rona said, there's 3 trials that are done, and the first one is practice, and then you average the last 2 scores that are recorded.
All right, and then we're going to demonstrate the functional reach test.
Okay, so the first version we're going to do is the regular version where you're going to be standing to the side against the wall but not touching the wall. So you can stand next to the wall for me. Great. Now with your arm closest to the wall, I just need you to flex your arm for me, shoulder at a 90-degree angle with your fists out. Great. All right, so now I'm just going to have you reach forward as far as you can without taking a step. I just wanted to make a side note that just to make sure that your feet are shoulder width apart and that your shoulder should be in line with your hips and your feet. Great. So now if you can just reach out for me. Great. Perfect. So the first trial is, the first time is just a trial. So I would measure where the third metacarpal would be on the yardstick at the end position. I'm going to have you do it 2 more times. So if you can reach out for me. Perfect. And just reach as far as you can. Great. And I would measure at the third metacarpal end position. And one last time, just reach out for me. Perfect. Okay, and now we're going to do the center reach test, modified version while sitting. So I'm just going to have you take a seat for me. And just reach your arm out at a 90-degree angle with your fist. Perfect. And just make sure that your feet are planted on the ground and that your hips are at a 90-degree as well as your knees, and that your back is touching the back of the chair. Perfect. Now I just want you to reach forward as far as you can. Great. So the first time is just a trial. I'm going to have you do it 2 more times where I would record where your third metacarpal would be at the end position. So I'm just going to have you do it 2 more times. All right, and just reach out for me. Great. Okay, and one more time. Perfect. Okay, thank you. Take a seat. All right, and if you can just reach your right arm out at a 90-degree angle, yep, with your fist, and just lean and try to reach at your side as far as you can. Perfect. Great. So I would record at the third metacarpal of the end position. So the first time is a trial. So I'm just going to have you do it 2 more times. Reach out for me. Reach to the side. Perfect. All right. And one more time. Reach to the side. Great. Thank you.
Okay, and now we're going to be doing the left lateral reach, the modified version. So I'm just going to need you to take a seat for me. Okay, and reach your left arm out at a 90-degree angle with your fist out. Perfect. And I just want you to reach to your side as far as you can. Perfect, and I would record there. All right, now we're going to do it 2 more times. So just reach out. Perfect. All right, and I would record at the third metacarpal. Perfect, and one last time. Reach out. Great, thank you.